This video is for qualified doctors, plastic surgeons, dermatologists, or owners of various hospitals who want to set up a hair restoration or hair transplant division in their present setup, or who want to enter into the field of hair restoration. In this video, we're going to discuss about why ISHR Fellowship Hair Transplant Training. So, dear doctors, to have a lovely, great, fantastic hair restoration practice, first and foremost is you got to know each and every detail encompassing the field of hair restoration, like indications, contraindications, safety measures, who are the right candidates, which are the latest techniques, more improved techniques, both for hair extraction, hair implantation, okay, the artistic part of hair restoration, like make how do you decide framing of the face with the hairline, okay, male, female, Asian, Caucasian, Arabic, Eastern part of the world. So there could be different anthropometric studies defining different shaping and designing of hairlines. So very specialized branch it is. Then newer machines, newer tools which minimize the risk, improves quality, improves graft survival. Okay, so so being in touch with the latest is very very critical because the medical science and especially hair restoration, newer developments and newer things are happening very fast. Number two, there are certain protocols which makes a great hair transplant. Okay, and there are certain stuff which unknowingly people are doing mistakes which leads to lesser results. Unfortunately, this is a commercial branch. People don't share much of information, especially the real valued information. So hair restoration surgery is not a rocket science. It is small small steps, right from the patient you meet first time to the 6 months follow up, done properly. The role of medications in great hair growth post hair transplant, okay, safety also is a very important consideration. The journey of a hair graft from back of the scalp, donor to the recipient, from body to the recipient, from beard to the recipient, that journey is very sophisticated. You cannot let the graft die because of drying. You cannot crush the graft. You cannot damage the graft. Then the real question comes is, you have made the slits, you put the grafts. The graft is here. The vasodilation, imbibation, inoculation is going to make it survive. It is once I cut the graft, its blood supply is cut. When I'm putting at the recipient, it's very, very critical. This graft takes up. 3 days are very critical because it is dependent on the blood supply of the surrounding tissue and the cells. So there are newer techniques which support these grafts for next 3 days. So now you understand instrumentation, newer ones, better ones for a better hair graft extraction. Better instruments, better techniques like keep implanters, semi-conical blades, etc. for least damage to the recipient area. As you see, if my graft is 5 millimeters, if this is 5 millimeter, epidermis, dermis, subcutaneous tissue, and if the graft is also 5 millimeter, I don't want to go straight. Why? Because below 3.5 millimeter is deep dermal plexus. Bleeding can happen, which can reduce graft survival. I have to go maybe around 30 degree at mid scalp. So, although I have gone 5 millimeter inside, where I can place the grafts, but I am not crossing 3.5 of 3.75 millimeter barrier so that I'm not damaging the deep dermal plexus. So I'm just giving you a hint. These small, small things are so critical. Okay. Instead of using forceps, there are keep implanters, virtually no root touch technique. Now, with these newer instruments, learning hair transplant has become easy. Previously, just to learn with double forceps, it may take you 1 or 2 years to expertise. But with the new keep implanters, 6 months you can expertise. Okay, so and it's a team effort. Apart from you getting expertise, you have to train your staff too. So why SHR is we attend the best of conferences, we are in touch with the best of researchers, and we are in touch with the leading surgeons of the world. So we keep getting, and we have our own clinic. So 14 years. So we keep learning. So whatever we have learned, whatever we have traveled, whatever we have accumulating, because now we are an academic group of doctors. Our major focus is research and development, teaching and academics. Okay, so major time goes there. So whole idea is what is going to come in next 3 4 years. We are going to get you now. Okay, so be ahead of the competition and be ahead and be better than the others. So now comes the question is that the role of magnification, the role of ergonomics, how you are setting placements, regenerative therapies, biotechnological therapies for better healing, post FU white dot scarring reduction. As I told you, once you put so many grafts here, you may be the best surgeon. If the person's scalp is not receptive, it may not take up the whole grafts. So now the future research is how to make sure that the implanted grafts has highest survival rates. So there comes the role of biotechnology, the growth factors, the vascular endothelial dilators, new angiogenesis products, free radical injury prevention. So there's a big topic. So here restoration is art, it's science, it's skill, it's teamwork, it's coordination, it's ergonomics. Okay, your team is critical. You cannot afford your staff to leave you. They should be there with you for long term. Now, why SHR again? Even if you're best surgeon, best team, best thing, but how will people know? So you got to have great videos and before after photographs. That is also a special chapter we teach you. How to take great hair transplant photos, how to make great hair transplant videos, patient testimonials. Because patients may be far off. They want to see without any problems, the correct lightings, correct positionings. They want to see your work with the hairline, with the angle directions, growth, density. So you have to showcase your work to the world. Because nobody has time to visit 10 clinics and choose one. Everything is digital. So your digital presentation is critical. That's also part of the training. Why we say ISHR is 360 degree? You may be the best doctor, but you got to let the people know who is the surgeon, who is this physician, what are his qualifications, what his work, what are his achievements, what sort of results he has given, what is his technique. So, knowingly, unknowingly, in today's world, you have to project yourself well. So, that part of branding, communication, skills, video making. So, we have separate team for that. So, we connect you to those teams who make your digital presence, who make you great videos, who train you what is the right clinic model for you, how to source. We have doctors and technicians across the world. When you are a new trainee, you're just starting a transplant center, you will need these trained doctors or the trained technician to be with you till your speed of a transplant develop. So when you join a SHR, most of the time you are given this support so that as soon as you go back, you can launch your hair transplant center. As you know, setting up a hair transplant surgeon is very, very easy and hardly cost anything. It's just a minor OT and hair transplant instruments. So even in any expensive city, it will not be more than $5,000 to start a new center, apart from 1,000 square foot space and interiors. Okay, so initial investment is nothing. The expertise and the skill is critical. The team is critical. Positioning, branding, communicating. In this competitive world, how do people find you in the crowded space? Okay, that's also critical. So, right business or clinical model is given to you. Who are you? What is your differentiating factor? What difference are you providing to others? Medical tourism for you. Okay, developing your team, coordinating team, the right software of a transplant clinics, artificial intelligence, digital presence, auto funnelings. This may be some different words for a surgeon or dermatologist, but I'm sorry, you got to learn these too in this today's world. You may be the best, but unfortunately, if you don't know all these things, the world is moving so fast, and maybe your youngsters are more faster than us. We have 50 plus, so at this age also we have to compete with them. Because I know some of my best friends who are the best surgeons, but they have less work. And these youth, they are active digitally. They know artificial intelligence. They're presenting well. They're upgrading themselves. They are giving more automation, more process and system driven. So at ISHR, latest protocols, whatever happening in the world latest, our faculty is attending the best. Our faculty has a cumulative huge experience. Okay. So Afro hairs, if you are from African part of the world, Caucasian here if you're Caucasian part of the world, Eastern here. So, it all differs from which part of the world you're coming to ISHR. Number two, once we are in a process of making 50 friends across the globe in top cities to be president of ISHR in that respective cities, so that you don't have to come to one place, the headquarters, but you can do a ISHR training at your place. So those who have good credentials, good infrastructure, they will be our future ISHR president secretaries in different parts of the world. Then those HR students who are academically oriented, they can connect to a scientific committee and they can present papers worldwide, do some research worldwide. So there are grants also, there are scholarships also, there are scholarship training positions also worldwide. Okay. And then we as a group of ISHR physicians worldwide, you can be part of it. We can practice as a group, you know. So there are webinars in between, who is doing what is the new findings, new research, new development. So in the webinar, all these ISHR doctors come together, once in a quarter and discuss what sort of practice are they doing, what are the difficulties they're facing, some special case studies. So ISHR now I hope this video lets you know that ISHR is not just conducting some workshop for a few days, then giving you some practical and theoretical training. Is much beyond it. It's a long-term association of group of ISI doctors to grow together, to read together, to research together, to publish together, and to help each other and enjoy our life as friends, as such as students together, as well as support each other to grow together. So I hope this video gives a 360-degree dimension about ISHR training. I've seen only when you're perfect both technically, your clinic model, your team, and your projection to the world. I've seen only those students doing very well. So all the best to you if you want to enter to the world of hair restoration, because baldness is increasing everywhere, though the competition will also increase because everybody wants to enter into the world of hair restoration. And not just hair restoration, there's a hair loss clinic concept also when non-surgical hair loss treatments are offered. A lot of new things are coming there too. Because baldies may be X number, but people losing hair are multiple times of balding. So if you want to know more info, only for the qualified doctors, you can contact at the below mentioned websites, email, and the telephone numbers. One of our assistant doctor will connect with you and give you all the infos about locations, durations, fees, faculty, and what sort of a support you can expect from us, how to set up your hair transplant center, where to buy the right instruments, everything will be provided to you. Okay? All the best and be in touch.